Inside the stories that affect you. This is Inside KELOLAND.
Good evening and welcome to Inside KELOLAND. From new moms and children to the elderly, 1 in 3 people is helped by Sioux Empire United Way programs. But that help wouldn't be possible without support from you. Tonight we give you a glimpse at how even the smallest of donations can help some of those in the most vulnerable of situations. Well, she may have been known as the Queen of Mean, but Leona Helmsley is making a significant difference in her death through her charitable trust. We'll explain how South Dakota is benefiting from this organization. And last week's snowfall had many people scrambling to find their winter gear, clothing that not everyone can afford. How Keep KELOLAND Warm is warming the hearts of donors and those in need ahead. Well, 33 communities from 4 South Dakota counties benefit from the Sioux Empire United Way each year. The organization is kicking off its campaign season with the hopes of raising more than $10 million. Now, joining us today to explain how your donations will be used throughout the area are Moni Simmonsma and Julie Becker. Welcome, both of you, to Inside KELOLAND.
Thank you. It's a pleasure.
Well, the fundraising kicking off now. What's that like? Is there a lot of excitement in the air now with this program getting off the ground?
There's a lot of excitement in the air right now when we're trying to raise almost $10 million and so many people collectively coming together to do this. Right now we have about 24,000 people who donate to United Way just in our local community and 700 businesses. And people who donate range from a child in school putting a couple of coins into a little piggy bank that the school offers, to the elderly, to the retired. I mean, the number of givers, we're just so blessed to be part of a community that has so many people who believe in this cause and donate and give to it.
If people are unfamiliar with the United Way, tell us about what it does in the community.
The Sioux Empire United Way is an agency who actually works with local nonprofit agencies and looks at the needs. It's all needs focused. So we identify the needs in our community, work with the local nonprofit agencies on what the best needs are in order to be able to fund. And so this year, the needs in our community came to $10 million, and I know this number by heart, $10,043,495. That is our campaign goal, and that is the true need in our community this future year.
Are you confident of reaching that campaign goal?
I'm confident. Julie,
yes.
We're confident, aren't we?
Yes, we have a very giving community here in Sioux Falls and the surrounding area that believes in giving people a hand up and helping those through the United Way.
And Julie, you're with the St. Francis House. How is the St. Francis House helped by the United Way?
Well, many years ago we started through the community impact process, which is a 3-year process. And then once after that 3rd year, we decided that it was time for us to go into becoming a partner agency because the need continued to be there. And we also needed the support of the Sioux Empire United Way. So we have been a partner agency for several years now. And what those funds do for our guests is it gives them a sliding fee scale to be living at our home. And so what ends up happening is when that amount that they pay is lowered, then they have more funds to be paying their debts back to the community, which then puts those monies back into the services of what we need in our community, and then turns around and potentially helps Sioux Empire United Way reach that $10 million goal.
Yeah, it's like a revolving process. Talk about some of the personal stories at the St. Francis House and how the United Way has helped them.
You know, when you have someone that is coming to the St. Francis House, which is probably at their lowest point, they don't have a job, most of the time they don't even have a change of clothes or, in this weather, a coat to wear. When you have the ability to say, this is what you're going to pay instead of this, it makes a huge impact for them. And when we can use those funds to be able to make sure that they have 3 hot meals a day, that they have warm showers, they have the clothing, the personal hygiene items that they need, that is truly bringing someone at their lowest point and bringing them at a higher level and giving them that hand up instead of a handout.
And Moni, how many organizations does the United Way help?
Yep, at this point in time, the United Way helps 39 agencies, nonprofit in our community, and 86 different programs. And the communities range, we serve 33 different communities at this point in time. And the communities range in a 4-county area, which includes Minnehaha, McCook, Turner, and Lincoln. So it's extensive, goes far and beyond just the city limits right here.
Now talk about what is the Heart Club?
The Heart Club.
Yeah.
A Heart Club is just a leadership level of giving. So it's any individual who really feels from the heart and believes in this and decides to give it a $500 or more level. So it's a leadership giving, $500.
Julie, why do you donate to the United Way?
Well, many years ago, when my husband and I started having children, we always read to our kids. And when the Dolly Parton Imagination Library was announced in our community, that's when my husband and I decided that we needed to take that next step, and we need to be Heart Club members so that we could make sure not only our children, but every child in our community had that same opportunity to have a book to read each night when they got those every month. And then about 4 years ago, my mother was diagnosed with vascular dementia. And she had been a nurse for 45 years and did not want to go to a nursing home. But because of her recent diagnosis, we had a very difficult decision to make. But fortunately, because of United Way funding the Center for Active Generation Senior Daybreak program, we were able to bring my mom there during the day so that she could be there for a period of time so that we didn't have to put her into a nursing home right away. And if it wouldn't have been for that, then my life as well as my siblings' lives would have changed drastically. And so that's when my husband and I decided to make that gift higher and become a Grand Heart so that we could show our gratitude to this community because we were able to have my mother served in that capacity.
And all the employees at the St. Francis House, they give as well.
Right. I'm a firm believer that it takes very little to make a huge difference in this community, and we receive those funds, and I have awesome staff that really believe in what the Sioux Empire United Way does. So if they work for me part-time, I know that they give through their primary job, and if they're with me full-time, we have that gift, whether it's a one-time gift or the Rising Heart, we have some, or the Heart Club members.
Moni, talk about the importance of volunteers to the United Way.
The United Way relies heavily on volunteers. In fact, throughout the entire process, from the funding process to the campaign process, United Way utilizes over 1,000 volunteers, which is amazing that so many people come forward to volunteer. And the funding process is quite an explicit and complicated process, and we're so grateful to the nonprofit agencies who come forward and submit an application. And these applications involve things like outcomes and results and budget information, but most importantly, the application identifies the need. What is our true need? And for that process alone, about 100 volunteers then get together and work together to determine what is our greatest needs and where can each dollar go to meet those needs in our community.
Do you still need volunteers? Do you need
Yes.
somebody wants to volunteer? How do they go about it?
Absolutely. Yep. If anyone wants to volunteer, they are more than welcome to call the Sioux Empire United Way office, or they can actually go to www.seuw.org.
Now, if somebody only has like $1 to give to the United Way, where does that money go to?
Every single dollar counts. 90 cents on every dollar stays right here within you and me. And like Julie said, the young children in our community who receive the book every single month, 90 cents stays directly right here between all of us.
And Julie, you go to a lot of rallies and talk about the importance of giving to United Way. What do you tell the people there?
Well, I always talk about the whole compassion of that this is all about a need and that there are so many needs in our community. I address that in some way, almost every single one of us has been touched by United Way, whether it be from the little girl selling Girl Scout cookies or using the MB swimming pool or going to Boy Scout events, or it might be even calling the Helpline Center because you need help with childcare, you need a resource, or maybe you're in some really dire needs and you need to talk to someone about some suicide prevention. There are so many agencies of those that are listed that have all touched us in some way, somehow. And so that's why I talk at the rallies about is not just about St. Francis House and how blessed we are to receive funds, but the process of receiving the money is not easy. We have a lot of work to do so that this money is just not thrown at us, that it's a rubber stamp. We have to earn those funds to be receiving them, and then what we all do and how everyone is touched.
All right. Well, thank you both for joining us for
Thank
Inside
you, Carrie.
KELOLAND.
Yes,
Thanks.
thank
You
you.
bet. And we're going to take a quick break. Stay with us inside KELOLAND. We'll be right back. Welcome back to Inside KELOLAND. Behavioral health is an important issue all across KELOLAND, but mental health professionals may not be as easy to come by in rural areas. According to a 2018 study from the American Journal of Preventative Medicine, 65% of non-metro counties in the U.S. don't have a psychiatrist. That same study finds 47% don't have a psychologist. Now, a big boost to Avera's e-care program could help change that. The Helmsley Charitable Trust has given a $7.8 million grant to the health system to expand its behavioral health telemedicine. KELOLAND's Kelly Volk shows us what this means for rural areas.
I'm here with Walter Panzier. He's a trustee with the Helmsley Charitable Trust. The trust just donated $7.8 million to Avera's e-care program. Why did you choose this particular area?
Well, for behavioral health has been a huge problem across all over South Dakota and the upper Midwest. It's not Helmsley's first donation to the area of behavioral health. We've been very active over the last 4 years trying to improve behavioral health care access, behavioral health care treatment, and also workforce development. Throughout the last 4 years, we've done donations up in Montana for a psychiatric residency program, to psychological stabilization units up in Montana, to studies in South Dakota to identify the problems and where the problems are with mental health. But this grant is the first grant to really answer and provide direct frontline treatment for people having crises in rural areas. What this grant will be able to do would be to allow physicians and in rural areas to have access and the specialty expertises of a specialty behavioral health care team that Avera will bring virtually through their e-care program into these small communities. And in year 2 and year 3, hopefully law enforcement and other EMS providers will have access to this as well. So that way treatment can begin in the home. As you are probably aware of, most behavioral health care emergencies are initiated by 911, and police and EMS are the first ones on the scene. And this will help give them tools and help give them the access to Avera's e-care to help these patients so they don't end up in jails, they don't end up having to drive clear out to Yankton or Sioux Falls. They can get treatment at home in the rural areas, and if they need to be transferred, they can be transferred to a more appropriate facility or even referred to the community for other services as well. It's something really unique that has never existed before.
Why are you passionate about behavioral health?
Well, I'm not just passionate about behavioral health. I'm passionate about everything that encompasses rural health. When you look at rural health and behavioral health, they're intertwined. For an example, if you have a chronic disease like diabetes or a chronic disease like Crohn's or even heart disease, if your mental health is not in check and you're not adequately receiving help for mental health, if you have a mental health care condition, your care for the chronic disease will also be impacted. You won't be adherent or be able to, studies have shown that you won't be as well as what you could be. And that's a big thing across South Dakota. That's a big thing across the entire upper Midwest when we look at that, because we want to avoid people showing up to the emergency rooms on any kind of condition, whether it's a mental health care condition or other preventable conditions. And it's giving people access to specialty care at home. And it doesn't matter whether you live in a rural area or an urban area. Your access should be the same, and the quality of care should be the same. And that's what this product does. And this is why I'm so passionate with the e-care system, because it's not just about behavioral health. This grant is about behavioral health, but there's so many facets to virtual health care where we can answer the workforce issues, the physician shortage, the access to specialty care. Because let's be real, most communities across South Dakota, even if you had workforce answered, you could not have the population to justify 24/7 behavioral health care by a team. And that's what this is going to do. This will provide 24/7, every day of the year, access to a whole behavioral health care team. And sometimes these specialties are only available 9 to 5 in these small towns, if they're available at all. So many of these small towns don't have anything like this.
All right, well, thanks for your time today.
Thank you.
Back to you in the studio.
All right, thank you, Kelly. With the temperatures dropping, Keep KELOLAND Warm is heating up, where you can find a warm winter coat for free when Inside KELOLAND returns. Welcome back to Inside KELOLAND. The death of a homeless woman 5 years ago due to the cold spurred what has become a fall tradition, donating and handing out coats to those in need. Before the coats can be given away, dozens of volunteers take time to sort through the thousands of items our viewers have donated. KELOLAND's Don Jorgensen recently caught up with the group who came all the way from Cedar Rapids, Iowa to help out.
Coat after coat after coat. There's a mountain of donations to go through. Volunteers are busy sorting them by gender and size.
So I think it's really nice to see a lot of people donating all their stuff instead of just throwing it away.
Zach Divide, a senior at Mount Mercy in Cedar Rapids, Iowa, is one of 9 students who came to help.
Well, we thought we wanted to go to a different state, like a neighboring state, kind of get outside of Iowa on the west side, because we were always over in Chicago. There's some service trips over in Chicago on the east side and Detroit as well.
The students say they're amazed by how our viewers have stepped up and responded to help others in need.
It's always good to be kind in this world. Like the way the world is headed right now, I think it's always good to be kind.
This isn't the only service projects the students will be doing while they're here. They also helped out at the St. Francis House, and they'll be painting houses for Habitat for Humanity.
The Mount Mercy students are on fall break right now. They decided what better way to enjoy the season than to help others prepare for winter.
I don't know, for me personally, a lot of people have helped me in my life, so I like to give back. Just because if you are nice to one person and then that person is nice to another person, it's just like a chain reaction kind of thing.
And that was KELOLAND's Don Jorgensen reporting. Joining us now to talk about how much this program has grown in recent years is our own Paul Farmer. Welcome to Inside KELOLAND, Paul.
Thank you, Perry.
Well, it's been 5 years ago now since the start of Keep KELOLAND Warm. Do you remember that first year? What was that like?
Yes, I do. It was very cold on our distribution day, but we saw a lot of people show up, and it was very gratifying to be able to hand over a coat to those folks.
Yeah. Were you surprised at the turnout that first year?
We were. We didn't know what to expect. Of course, we didn't know what to expect for getting donations when we were certainly pleasantly surprised about how many donations we received, and they just keep coming in.
Yeah. And Keep KELOLAND Warm has grown through the years. How has it changed in the past 5 years?
Well, probably the most significant changes last year, we added the new coats from the Kids in Coats folks that decided to join us and find a good distribution point for them, because they were already doing this and buying some new coats and raising money for that. And so being able to provide a good distribution point for them, for the new coats for kids, and then also being able to reach out beyond Sioux Falls and be able to do donations or distributions. Like this year, we're going to be in Madison and in Watertown. So, which just speaks to the need that it isn't just a Sioux Falls area thing. This is the need goes out throughout all of KELOLAND. Talk about that need and what people need to have for winter coats and that kind of thing.
Well, we always find people that come in, individuals and families come in, and to see the kids that find a coat that maybe they don't have, and those that maybe work out in the cold and need some warm clothing, hat or gloves, or maybe some coveralls that they're looking for, or just a really nice warm coat that they'll be able to take the strong winters that we have here.
Yeah.
So
yeah. Well, we just had our first distribution of Keep KELOLAND Warm this past Thursday. What's it like to see these people as they pick up their coats?
Just to see their faces and the thank yous that they give, and they so appreciative to be able to come and pick out a nice coat. And a lot of those coats that we receive are, maybe they're not new, but some of them are new, but some of them are very, very nice coats. And for someone to be able to get one of those coats that they really need is very heartwarming.
And there are going to be more giveaways in the future. Tell us about that.
Yes, we have more coming up. You can go to KELOLAND.com and find all the different dates and locations where we're going to have giveaways. Like I say, we're going to be in Madison, and again in Sioux Falls at the banquet, and we'll be in Watertown, the Montgomery store there, and at the fairgrounds again in conjunction with the food giveaway on the Fridays. And so we'll be there, and then we'll have our last planned distribution day will be at the Bishop Dudley Hospitality House.
Talk about what it takes to put these giveaways together, as far as sorting and that kind of thing. And the volunteer help as well.
Yeah, for us, you know, we just have great partners in Lewis Drug to provide those locations where people can drop off their coats. And of course, it all starts with that and the wonderful folks that are able to drop off donations of coats and hats and other winter apparel. And then from there, our good folks at Montgomery's Furniture, they can pick up all the coats, they'll bring them to their warehouse and get them sorted or stored there. And then we have these sorting events where all of our 3 companies come together, Kello and Montgomery's and Lewis, and we even get some volunteers like you saw in the news package there that come and help us and do all the sorting, because there are literally thousands of coats that we receive, and so we all need to sort those out by gender and size and get those ready for distribution.
Yeah, you talk about gender and size. Is there any one particular types that you need more than others, or tell us about that?
A lot of time the demand is for the larger sizes, so there just isn't as many of those in the donations. So, you know, the bigger 2X and so forth, and bigger sizes like that, and also for kids, of course. We always run out of the kids' clothes.
And what happens at the end now when the distributions are over? What happens with some of are there winter coats left over, and what happens with those?
Some of them have been brought out to the reservations in South Dakota. We've had a lot of our donations at the end. When our distribution is over, the folks at St. Vincent de Paul will come pick them up and have those in the thrift store. So that's also a good thing too, to be able to find a place for those coats to go where people can get them.
And if people want to keep donating, tell us what the process involved in that. How do they get their donations?
The donations will still be accepted at all the Lewis Drug stores in Sioux Falls except for the downtown location. So you'll find the boxes right there when you walk in the door. And we're going to keep accepting donations up until that Wednesday right before Thanksgiving.
And people are responding very strongly this year, right?
Oh, yes. We've had our sorting this past week, and there were literally thousands of coats there in big grocery or garbage bags and boxes that were filled with coats that we sorted out.
Okay, well, thank you very much for joining us, Paul. And we're going to take a quick break. Stay with us inside KELOLAND. We'll be right back. You can find out more about today's topics online at KELOLAND.com. Just click on the Inside KELOLAND section. Join us every Sunday following the 10 o'clock news right here on KELOLAND TV. And that is all the time we have for today. Be sure to join us again next week for more on what's going on inside KELOLAND.